Good afternoon, and welcome to our virtual town hall devoted to return to campus at Johns Hopkins University. I'm Lainie Rutkow, professor in the Bloomberg School of Public Health and senior advisor to President Ron Daniels. I serve as one of the team members leading our COVID planning efforts, and I'm delighted to be moderating this session today with three of my university colleagues who lead our 2021 planning work. Today, I'm here with John Links, who's a professor, vice provost, and the university's chief risk officer, Jane Schlegel, vice president and the university's chief administrative officer, and Bob McLean, vice president for facilities and real estate. The goal for today's session is to discuss the university's plans for the staged return of activities on our campuses and to answer your questions about this process. As we noted in a message sent earlier this summer, we have the hope and expectation that the university will be substantially back to normal this fall. Before I turn things over to our panelists, I want to take a moment to describe the consultative process that accompanies our planning. First and foremost, our priority has always been ensuring the health and safety of our community to the best of our ability. And we continue to be guided by our medical and public health experts in responding to this evolving pandemic. We've assembled multiple COVID-specific groups that routinely provide advice, consultation, and feedback to university leadership. These groups include a health advisory group composed of leading Hopkins public health and medical faculty experts, a student advisory committee, which includes representatives who span our student body from freshmen through doctoral students, and a university pandemic academic advisory committee, which includes faculty representatives from the university's different schools. We continue to employ a framework of 3 phases of operation based on state and local regulations and our own experts' assessment of the public health situation. We're now in phase 3 of our reopening plan with the resumption of higher density activities, and we intend to be substantially back to normal this fall. In our announcement for this session, we asked you to please send us questions beforehand, and we appreciate the many that we've received. Below this screen, you'll see a box that will allow you to send in questions in real time, and we'll answer as many as we can. And I will be keeping my eye on those questions throughout the session. Like our other sessions, this town hall is being recorded and will be available for asynchronous viewing. I'm now going to invite each of our panelists to give opening remarks, and then we'll move into Q&A. John, first I'll turn to you. Can you please speak about measures that we're taking to mitigate the health effects of the pandemic, including the vaccine mandate, testing and masking, and dining?
Sure. Thank you. Good afternoon, everyone. From the very beginning of this pandemic, we've approached health and safety as our #1 priority and have always relied on a combination of control measures to produce health and safety. And that's no different in phase 3, even as we return to near normal in our operations. The linchpin of our plan is our vaccine mandate. As you know, every student, staff, and faculty member who is on campus at one of our other work sites or traveling on behalf of the university falls under the mandate. And the mandate is to have either an FDA authorized, a WHO authorized vaccine, or an approved medical, religious, or pregnancy exception. We have rolled out a vaccine management system so you can either upload your documentation of vaccination or request an exception. And we're expecting all affiliates who will be on campus at a Hopkins worksite or traveling on behalf of Hopkins to do so by August 1st. So vaccination is the linchpin of our control measures, but it is not our only measure. For those who have an approved exception, they will be required to mask while indoors and to test twice weekly at this point for the duration of the semester. We also ask that those who have an approved exception eat at a 6-foot distance from others if eating indoors. That would include shared offices. If one of the people in a shared office has an approved exception and is unvaccinated, they must eat at a 6-foot distance from the other occupants of that office. So I've talked a little bit about vaccination, masking, testing, and in certain circumstances, distancing. These are all control measures you've heard about before. And we're not forgetting about the other control measures we've had in place so far that will continue to be in place: hygiene and enhanced room ventilation. So the plan is to continue to use a suite of control measures that are matched to the current circumstances of the pandemic.
Thanks very much, John. I'm now going to turn to Jane. Jane, will you please speak about campus operational planning, including our vaccine management system, the VMS, as well as prudensity and compliance more generally?
Sure, Lainie, thank you. Appreciate the time for everybody. Let me first talk about the vaccine management system, or what we like to refer to as the VMS. So anyone who's not been vaccinated at the Johns Hopkins Medicine facility must upload their COVID-19 vaccination record into the VMS. That link is vms.jh.edu. So once again, and we'll add links to this video so that once it's shared, you'll have all these links as well. But again, vms.jh.edu. If you have an exception, you want to submit the exception request into the VMS as well. If you're vaccinated through a Johns Hopkins Medicine clinic, your vaccination documentation may already be loaded into VMS. And if so, you will receive an email confirmation and not need to do anything more. Currently, we've had 75% of the staff upload their documentation and just slightly less for faculty. So kudos to everybody that's uploaded. We're thrilled that we've got it. And the deadline, as John said, to upload is August 1st. We will send reminders this Friday as well as next. Compliance with the vaccine mandate is going to be monitored with through Prudensity, which is the same system that's been used for daily health checks and to monitoring testing compliance. So that was what we used through the fall and into the spring. Compliance with health checks. We're going to expect everybody to do their health check. It's 2 questions. Vaccine and testing will provide the appropriate Prudensity campus pass. If you're provided an exception and do not comply with the testing requirements, which is twice weekly, you will receive a red campus Prudensity pass and will not have access to the campus. All employees and students who are on campus must complete the daily health check, as I said. And if you're 100% remote or online, you should change your status in the Prudensity to indicate that you're not coming to campus. So we can follow up on that in this video as to how to do that. If you need a vaccination and you haven't been vaccinated yet, you can schedule an appointment through Johns Hopkins Medicine through MyChart. We're also providing a series of vaccine clinics on site. So there's one tomorrow at the School of Nursing, 9 to 10, and there's one scheduled right now, August 5th at the Glass Pavilion on the Homewood campus. We will have many more clinics through the month of August that folks can take advantage of. And if you need any information about MyChart, you can go to email testinginfo@jhu.edu. Just as another note, flu vaccinations will be required this year. We will follow up with more information about the flu vaccine as we get closer to the fall, and it will go through the Prudensity app as well. It's what we did last year, we're going to copy again. The process for compliance will be similar to the process that we had in the fall. The Prudensity reports will be sent to each division, and those divisional teams will manage with their HR business partners, employees who are on campus, unvaccinated, and or have exceptions who are not complying with testing. Similar to the flu and testing compliance in the fall, there will be review, counseling, and progressive discipline process for those not in compliance. Last, I want to talk about the visitor, guests, and contractors. We have visiting faculty, scholars, and students have jet ideas, and they should upload their proof of vaccination status. All others are considered guests and not subject to vaccination mandates. Unvaccinated guests are required to wear masks. Contractors who provide full-time services and consider their primary work location a JHU facility or work site are to be vaccinated or receive an exception. And we're working through Bob's team, Brian Smith's team to do those. And then the final thing I want to say is from an event perspective, outdoor events can be held without any capacity limits, indoor or limited to 50 unless special permission is granted, and food for indoor events also needs special permission. Any questions related to that, you can email the cao-office@jhu.edu. And with that, I'll pause there, Lainie, and turn it back to you.
Thanks very much, Jane. Bob, I'll now turn to you. Can you please speak about facilities planning, including parking, HVAC, signage, and transportation?
Great. Well, again, let me add my welcome to everybody and good afternoon. With respect to building signage and planning, I know that some of you have been back to campus or your offices and some of you have not, but as you return that you will notice a change in building signage. The guidance has eliminated a number of the requirements that was published in the phase 3 guidance. Things like masking, density limitations, guidance around elevators and restrooms, all of that has been changed. And so we're in the process of eliminating those signs at building entrances, elevators, stairwells, restrooms, and conference rooms. However, we're also in the process of adding back a few signs. One, just reminding people of the vaccination requirement, and for those who either have an exception or are not yet vaccinated, that they should be wearing a mask. And also very importantly, please respect people who either need to or choose to wear a mask as an extra mitigation measure. Additionally, we mentioned now that in general, dining capacity limitations have been removed. The exception, as John noted, is that people who are not yet vaccinated or choose to eat in a de-densified environment, we want to make sure there are options. So places like cafeterias and dining rooms, there should be spaces set aside for dining. We're also working with the divisions to make sure that perhaps some conference rooms or other space is also de-densified. And so we are working to make sure that those areas are signed and noted as a de-densified eating area with the associated capacity limitation. So those are some of the sign changes that you'll see as you return to campus. Again, as John mentioned, we worked very hard last year to look at our mechanical systems. We worked to increase filtration wherever the systems allowed us to, the maximum extent possible. We increased the quantity of outside air, and we also increased the hours of ventilation to increase the number of air exchanges per hour in all of our facilities. As we plan to return back to campus, we've worked with the various facility teams and health, safety, and environment to continue to assess our building ventilation with those key components. Again, the air turnover, the amount of outside air and filtration levels to make sure that we are comfortable in a good position and identify any areas that might need some additional work or mitigation. If you have questions or concerns about your particular spaces, you should contact your departmental administrators, your divisional business or facility reps, or perhaps your supervisor, and they can reach out to the facility teams and or the property management teams, and we can provide general updates on what we've done for your particular building or area. With respect to transportation and parking, we have returned in July to full capacity on our buses and shuttles. Just consistent with building guidance, masking is required if you are unvaccinated. And again, just like we are doing for buildings, there are many people who either need to mask because they have an exception or because they choose to mask as an additional mitigation measure for them personally. And again, we want to be able to respect everybody's rights and comfort level in masking, but it will not be required for those who are vaccinated. In terms of scheduling, we're generally back to full schedule. So our main shuttle buses are on full schedule. Our night rides are running from 6 p.m. to 2 a.m. On Homewood campus, and we'll be starting at Peabody as the school year returns. Our Keswick and Homewood shuttles are operating Monday through Friday, and we will be starting our Remington and Homewood to Mount Washington shuttles on the 2nd of August. As always, we do provide accessible services for those people who need some additional services, and that can be coordinated whenever needed. Additionally, some people do rent out hot vans for particular moves or needs, and those hot vans are available to be rented if you're an authorized user. So again, generally returning to full transportation services, and by the 2nd of August, we'll have all of our shuttle runs operating. With respect to parking, just some general information. One is that we have kept permit rates the same for the 3rd consecutive year, so there are no changes or increases to our permit rates. However, recognizing that there are a number of employees or affiliates who may now be on a hybrid or remote schedule, we are now making available at all of our garages a daily rate. This has been in existence for some of our garages, but is new for Keswick, Eastern, and Mount Washington. I have to say that each campus, and in many cases, each garage is a little bit different in terms of its rate or process. So we have an FAQ on the website, and as well as one that's mirrored on the transportation website that provides all the specific details in terms of how to access. For those people who suspended or canceled actually their permits, you can apply for reinstatement. That's going to be on a first come, first serve basis for all of our garages, but you may apply. We do expect and are seeing potentially some wait lists. We are trying to manage both the permit demand and this new daily permit demand. And so we'll be working through that as people return to campus. I believe that's all I have, Lainie, and standing by for any additional questions or clarification.
Thanks so much, Bob. I'm now going to turn to the questions that have been coming in, and I want to encourage everyone who's watching, if you think of additional questions, please do submit them. I'm keeping an eye on the list throughout this session. So Jane, I'm going to start with some questions that are coming in about prodensity. One is, after uploading proof of COVID vaccination, do folks still need to do the prodensity check-in?
Yes, we are wanting everybody to do their health checks daily. And again, it's 2 questions that are being asked of you.
Thanks, Jane. And what about for individuals who don't have a smartphone? How do they interface with prodensity?
So we want to reach out to them and help them. There is a web form that we can utilize. And so I will, if you can email the CAO office, we will help them work through that.
And in terms of compliance, when folks are on campus, how is their prodensity compliance being determined?
So essentially, they're checking Wi-Fi between 2 different access points over an hour. So if you're on campus for an hour, they're marrying up 2 different Wi-Fi access points to know that you're on campus. And with that, checking that your status is green. And so that's what will kick out reports to us to monitor if folks are not supposed to be on campus, or they're not, if they have an exception and they're not doing testing, we'll know that they're not doing their testing through prodensity.
Thanks, Jane. John, I'm now going to turn to you with some questions related to the vaccine mandate. What happens to individuals who aren't able to get their second shot scheduled before the August 1 deadline?
So for those who are in the process of vaccination, they obviously cannot upload the documentation of completion of the 2 shots. And so for them, they will wait until they've received the second shot and can upload complete documentation. In the meantime, they should mask and test twice weekly if they're in any of the categories I described earlier, on campus, at an other JHU work site, or traveling on behalf of the university. Obviously, their managers are going to know they haven't uploaded their documentation and will reach out to them, as long as they are in process and are masking and testing in the meantime, everything will be fine.
Thanks, John. Another, actually several questions that I'm going to consolidate regarding exceptions to the vaccine mandate. So first, can you speak again about what the exceptions are? And then what happens to folks who receive an exception? And what happens to folks who do not receive an exception, but also are not vaccinated?
Okay, so there are 3 different exceptions. A medical exception, a religious exception, and a pregnancy exception. You apply for each of those through VMS, the Vaccine Management System, exactly the same system you would have used to upload your documentation of vaccination. You obviously, at any one point, only apply for one of those 3, medical, religious, or pregnancy. With respect to medical exceptions, there is only one automatic medical exception, which is an allergic reaction to the vaccine or one or more of its components. Often that means the person received the first dose of a 2-dose vaccine, had a reaction, and their healthcare provider said, don't get the second dose. And so you upload documentation of that and you're granted the medical exception. Because all of us as individual human beings have unique circumstances in terms of our health, there may be other combinations of factors on a case-by-case basis where a healthcare provider has determined that their patient, you as their patient, should not be vaccinated. And we are, of course, looking at documentation that you upload from your healthcare provider that gives a medical reason for not being vaccinated. And then our own medical experts are making an assessment based on that documentation. If you have an approved exception, in lieu of vaccination, you mask and indoors and test twice weekly. If you do not upload documentation of vaccination or request an exception, you are in violation of policy. Being vaccinated or having an approved exception is, at the end of the day, a condition of employment. Now, obviously, there is a process here. And so for those, for example, who are in the midst of getting vaccinated, to the earlier question, you're going to mask and test twice weekly until you've completed both doses and uploaded your documentation. For those who have requested but not yet received an approved exception, you're going to mask and test twice weekly until you receive word about that exception either being approved or denied. In the case of those who intentionally do neither, don't upload documentation, don't request an exception, by August 1st, you're out of compliance. And we will be working with you, your manager, and HR to understand your circumstances and to lead you through a process that I think all of us together hope at the end of the day plays out properly for you and for us in the context of our mandate.
Thanks, John. And a follow-up, I see additional questions coming in, but this one, Jane, I'll send it to you. So for employees who are unvaccinated without an exception, without an approved exception, can't they simply work from home?
So working from remote is not an exception to getting vaccinated. You need to work with your manager, the divisional business partner that's in that division, and work through that process. But that is not a reason to work remotely. If you have been okayed by managers and or your DBO to work remotely, then you're not going to be, I mean, you're fully remote and you're not going to be on campus. You don't have to be vaccinated. We'd love you to be, and we'd love you to still upload your vaccination. But it's not a reason, an exception to not upload and be vaccinated.
Thanks, Jane. John, I'm going to turn back to you. No surprise, lots of questions coming in about the Delta variant. The common theme here is, what are we doing on the university side to monitor the situation?
So from the very beginning of the pandemic, we've been closely following all the usual metrics, including what's happening here in Baltimore, in Maryland, in DC, throughout the country, and indeed throughout the world. And that monitoring very actively has not changed at all now for, a year and a half. All of our decision making about our operating posture is based on that monitoring and based on extensive consultations with our own medical and public health experts. That too will continue. We, of course, are keeping our eye specifically on Delta and other variants of concern. Delta is concerning, but it is not the only variant of concern. And we are tracking what's happening overall in terms of new cases, hospitalizations, deaths, etc. We're tracking what fraction of all new cases is each variant, and Delta, of course, is the majority of the new cases in the US these days. And we are poised, if necessary, to reinstate additional control measures. We are not there yet, but we will not hesitate if we think it's appropriate, for example, to reinstate masking for all indoors rather than the current masking if you're unvaccinated plus voluntary additional masking. We will not hesitate, if it's appropriate, to reinstate asymptomatic saliva-based testing for everyone who's on campus. So we are following what's happening. We are poised to enhance control measures if and when we think it's appropriate. And we will continue to follow what's happening and to continue to be poised. And we have the capacity to reinstate, for example, asymptomatic testing at the level we had done it in the spring. So we've kept all our capacity intact so that we can make changes as conditions warrant.
Thanks, John. Bob, question for you. So most of the communications and the way that we talk about this refers to on campus. Can you speak about how the various measures that have been mentioned apply to other buildings that have Hopkins affiliates, for example, Candler and others?
Sure. Thanks for the question. I think it's a terrific question. What our intent is that where Hopkins controls the space, these policies apply. So within the tenant spaces in leased facilities, then the requirement to be vaccinated, the requirement to wear a mask if unvaccinated, all of those requirements apply. And we do not control common areas in our leased buildings. So for instance, I mentioned that we're removing signs from our library, or from our elevators and from our restrooms, and we're no longer having density restrictions. You might be in a building where the property manager is still requiring some restroom limitations. Perhaps they're restricting capacity on certain elevators, and you should abide by those. But our guidance should apply within the property that we control. And,
Thanks,
and
Bob.
there's another question, Lainie, that I'd like to address. It's come up quite a bit, and John, maybe you need to jump in if you need to add to this. But there's been a lot of questions about what do you do about staff meetings and food and such. And because we have eliminated the density restrictions for dining, you can have food and such at meetings. But something that we want to be very sensitive to, and I'm certainly conscious of amongst my team, is that you do have people that may have an exception, and you do have people that may choose to want to eat in a distance environment. And we need to make sure from an equity perspective that we're cognizant of all of our team, and that if you do have meetings where there's food, that you are providing space for people who are comfortable and can eat or be in a de-densified environment. So I just wanted to make sure that I saw that question come in. I want to make sure I answered that.
Thanks, Bob. There have also been a couple of parking questions that have come in, so I'm going to stick with you and ask those. One is concerning reduced daily rate for East Baltimore. What is the parking situation there?
It depends on which lot or indoor garage you park in. There are different rates for different garages and or lots that you can park in East Baltimore. So should people choose not to reinstate their permit, they can choose to pursue daily rates. And the East Baltimore parking site, so the Johns Hopkins, and we'll put that on the website, but the Johns Hopkins Hospital parking website can lead you to the different rates, and it ranges anywhere from about $6 a day to $15 a day, depending on which garage and or lot you choose.
Thanks very much, Bob. Jane, I'm seeing several questions coming in about events. So I'm going to turn to you now. And one was if you could restate what you said in your opening remarks about the various limits for in-person events.
Sure, Lainie. Outdoor events can be held without any capacity limits. Indoor are still limited to 50, and they need special permission to be granted. And food for indoor events also needs special permission to be granted. So you can send those event questions to cao-office@jhu.edu. We are managing those daily, those questions, and getting answers back quickly.
And so, Jane, I think we have a few examples of those types of questions coming in. One concerns having food for staff celebrations. So that's the kind of request that should go into to the address that you just stated.
Yeah, indoor and above that limit. Yep.
Mm-hmm. Same for student trainings that are above that limit but need to be indoor. So and maybe Jane, could you say that email address one more time, please?
Sure. It's cao-office@jhu.edu.
Thanks very much, Jane. And Jane, I'm going to stick with you because we have a lot of questions coming in related to questions that can be asked or how information is known about individuals' vaccination status. So I'm going to try to consolidate some of them into a question about what do supervisors know about the vaccination status of folks in their group?
So strictly supervisors, managers, all they know is if you're not vaccinated, and they only know if you have an exception, not what exception you have. They don't know if you've got medical, religious, or pregnancy. That's all they know. So we are sending those reports out towards the middle to end of August. We've got to collect all that information after the August 1st deadline, and we will be monitoring those, but they will not know any more detail besides vaccinated, unvaccinated, or exception, and no details to the exception.
And can your supervisor share your vaccination status with anyone else?
No, they should not be. They should just have it for their use only. They need to be monitoring masking for those folks that are have an exception or are currently unvaccinated. They want to make sure that they make sure those folks are following proper protocol with masking.
Thanks, Jane. And a follow-up to that, for those who find out that a supervisor has shared their status, what is their vaccination status? What is the process?
They would want to alert that to their HR business partner.
Okay, thank you. I am, and Jane, as long as you're here, I'm seeing a pro-density question, so I'm going to stay with you for a sec. This is pro-density without a smartphone. Can you explain again how those without a smartphone can log into the pro-density system?
So I don't have the website right now with me, but I'll make sure that we clarify that. But there is a way to go through your laptop or your desktop. And we will definitely get that information out at the end of this video and make sure that we highlight that in frequently asked questions.
Thanks, Jane. John, I'm going to turn back to you now. And this is a question about what to do if you are symptomatic. So if you have COVID symptoms, how do you determine, obviously you shouldn't come to campus, how do you determine when you can come back to campus?
So one very important thing that has not changed is the Johns Hopkins COVID call center. And as has been the case for many, many, many months now, if you are symptomatic, you call the Johns Hopkins COVID call center. They ask you questions. They arrange symptomatic testing. They tell you the results. They tell you what you need to do. None of that has changed. You are not on your own at all. And so we want affiliates who are symptomatic to call, as they would have done in the past, the Johns Hopkins COVID call center.
Thanks, John. Another question, if you can speak a little more about the pregnancy exception and the reasons for it.
So the pregnancy exception is separate from the medical exception. Frankly, there is no medical or scientific evidence that the vaccine in any way interferes with being pregnant or with a woman trying to conceive. However, in an attempt to support our affiliates, we have elected to add that as an exception for women who are pregnant or trying to get pregnant. And that exception requires an attestation to that effect.
Thanks, John. Back to the August 1 deadline. What happens for folks who do get vaccinated, but for one reason or another, it doesn't happen until after August 1st? When can they come to campus?
So folk who are, first of all, in this country, the vaccine is unbelievably readily available. And as an employee, you are offered time off to get the vaccine and to stay at home the next day if you have side effects. So it should not be a challenge given the time leading up to right now and the time still remaining to begin the process of being vaccinated. During that process, meaning the time you're waiting in between the first and the second dose, and the time 2 weeks after the second dose until your immune system response is maximum, you will mask and test twice weekly. And as long as your manager and the HR business partner know that you are being vaccinated in progress, so you haven't yet been able to upload your documentation to VMS, you will be fine. The same is true if you've requested an exception and have not yet received an answer back from us as to whether it's approved or denied. You're fine. You can be on campus, but you have to mask indoors and test twice weekly.
Thanks, John. And I'm going to stick with you for some testing questions. So the first is, what are the types of tests that are available? Will we be sticking with the saliva-based test? And will the testing sites continue to be available?
Yes, we're sticking with the same saliva-based testing. Yes, the testing sites remain available. What changes is that we're going to a self-serve model where you show up, you fill out the label, stick it on the sample collection tube, spit into the tube, and then you put that sample into a repository, which looks like the same sort of standing type of container when you return library books or when you're making a bank deposit. So it has a special kind of door where you can put the sample in, but nobody can stick their hand in and swipe other samples.
Thanks very much, John. Jane, question for you about student vaccination status. So can faculty ask students about their vaccination status?
So from a supervisor perspective, they will get reports through their departments for the students as well, so that they will know. They also, as a supervisor of those students, can ask, because they're in that role to be able to ask that, but again, should not be sharing that with anybody else.
And it is not sorry, just to be clear, if you're so I'm a professor, I teach, I cannot ask my students in class if they're vaccinated or not. This is, as Jane is emphasizing, strictly between a supervisor and a supervisee. The supervisee could be a student or a staff member or indeed another faculty member, but it's only if you have that formal supervisor-supervisee relationship that the supervisor should know the status of folk.
And just to add on that, you might have friends or somebody that asks you, you don't have to tell them your status. So it's up to you if you want to share it, but between coworkers, they should not be asking each other if they're vaccinated or not. That's strictly your place to tell somebody if you want them to know.
Thanks, Jane. And as a quick follow-up, can you say once more when supervisors should be expecting to receive that information?
We will get reports out. We're working on them this week and next week, and we will start getting reports out leading up to August 1st and certainly through the month of August. We want a little time to look through, because there's going to be folks, as John said, in the middle of getting vaccinated, possibly before the August 1st deadline. So it is a very, it's a longer process of, we're not going to, the minute August 1st comes, look to everybody and say, well, you're not in compliance. We will work through this in August. And as John said, business partners and managers into September will do counseling and progressive discipline for those that just do not want to be vaccinated.
Thanks, Jane. So a quick follow-up to what you just said, then for supervisors who have staff who have not uploaded their vaccination status to the VMS and are not compliant by August 1, what is the supervisor's responsibility at that point?
So we will get, similar to what we had as a process in the fall and into the spring, there are what we call divisional response teams. So they're DBOs and other deans at each of the divisions and units. They will get a report and can look at whether it's a faculty, staff, or student who's not vaccinated, and then work with managers and supervisors to start contacting them. HR business partners for each of those divisions and units will be part of that process as well.
Thanks, Jane. And I'm going to stay with you for a moment on the theme of who can ask what. For guests or delivery people who are coming in, can they be asked about their vaccination status?
So first of all, what we classify as guests are folks that are just in and off, or contractors that are in and off and not looking at Hopkins as their main point of a work location. Those folks should be masked. We are going to assume that they are unvaccinated if they're masking. They might also be vaccinated and feel like they're comfortable with the masking, but we should not be asking them. We will be doing that through either Bob's group or Brian Smith procurement with contractors and vendors. So somebody like a FedEx delivery person who's in and out, we are not asking for them to be vaccinated. They should be masked as they come on and off campus.
Thanks, Jane. John, back to you about the testing sites. Can you say a bit about the timing for those and availability?
So there are testing sites available right now. As we enter the fall, we'll be opening even more sites. The COVID info website has the location of the sites, and we'll keep updating it as we open more and more sites, but no one should have trouble finding a testing site. And because you can basically just waltz in and grab a sample tube and spit into it whenever you want. It's not a question of, oh gosh, I can't get an appointment at the time I need it.
Thanks, John. And another question for you about return to campus. If you have someone in your household who's tested positive for COVID, then what is the protocol for the Hopkins affiliate in terms of returning to campus?
So we want people who have a household exposure to call the Johns Hopkins COVID call center. What will happen is, if you're vaccinated, you will go into a 5-day quarantine, and at the end of the 5 days, get tested, and if it's negative, you can return. If you are unvaccinated, you go into a 10-day quarantine, and at the end of the 10 days, you can get tested, and if it's negative, return. This is for you in quarantine as a close contact of someone who is positive for COVID. And that close contact is a household contact. If you are vaccinated, the only close contacts that require quarantine are household contacts. So it's a much reduced quarantine setup for those who are vaccinated compared to those who are unvaccinated.
Thanks, John. Another question for you: for international students, must they be fully vaccinated before they arrive in Baltimore?
No. In fact, we are anticipating international students and other international visitors who could not get any access to vaccine from where they're coming from. Such people will get their first dose the day they arrive or soon thereafter, and in the meantime, will mask and test twice weekly until they've received their second dose and are in fact 2 weeks out from their second dose. And we will be holding vaccine clinics. Johns Hopkins Medicine is offering vaccination every day as well. Plus, of course, pharmacies and other healthcare settings are offering free vaccination too. So there's plenty of ways to begin the vaccination process, and you do not already have to be vaccinated to arrive.
Thanks, John. Another question for you to clarify the state of emergency and what that means.
So this is the Maryland state of emergency, and the governor extended the state of emergency to mid-August. That was done for one specific reason: to permit legal protections that are in place, for example, against eviction, to continue for a little bit longer. It is absolutely not a reflection of the state of the pandemic in Maryland, and the motivation had zero to do with the disease or community transmission itself, and everything to do with trying to take care of people for a little bit longer.
Thanks, John. And I want to give an update to everyone who's watching. As questions have been coming in, our team has been updating and adding links to the page that you're watching this session on. So if you refresh your browser, you'll see a series of links right underneath this video player on the page that you're watching from. And those links include information about the vaccine management system, parking, the email addresses that we've referenced. So there's a wealth of information that's being posted right below the video player as the session goes on. And again, if you're not seeing it, you just have to refresh your browser and you'll be able to see all of those links that I just mentioned. Bob, question for you about parking, and as everyone gets back into the groove with return to work, is there any kind of a grace period planned for?
Quite frankly, we've had a grace period for a long time at a number of our lots and garages, particularly our surface lots. And so, we do have a number of people who are working full time on campuses, and we do have a number of people who are starting to return. And so we are proceeding with the parking guidance in terms of needing to either, have a daily pass or to purchase a permit.
Thanks, Bob. Jane, question for you: for employees who need to test twice weekly as part of their exception, do they do that on their own time? How does that work in the context?
No, they absolutely can do that during their work time. We would like them to, it's nice to be able to do it first thing in the morning at the end of the day, but if the convenient place and location is something that you need to get to in the middle of the day, we've tried to set up the testing sites as convenient as possible. There's going to be a self-service in nursing and public health. So we've tried to distribute it around Eastern, Keswick, to make it as easy as possible so that even if you had 5 minutes to run down, you could do it. So hopefully everybody will test that need to test. And like I said, they should be able to do it at any time during their work hours.
Thanks, Jane. And another question for you about the VMS. For individuals who received notification that Hopkins has a record of their vaccinations and they don't have to upload, just a reassurance that they are in compliance.
Correct. And that's more than likely they went to a Johns Hopkins Medicine facility, and that's why they got an email confirmation. So they don't have to do anything else.
Thanks, Jane. And John, I'm seeing a lot of questions coming in about indoor masking, and the common theme here is, and you spoke a bit about this earlier, but I want to revisit because the questions are still coming in. Will the university revisit indoor masking in light of whatever the public health conditions are as we move through the summer and into the fall?
The answer is absolutely yes. We'll revisit it if warranted. I want to say something more, which is to pick up on a comment Bob made. All of us and university leadership have an expectation that if someone wants to wear a mask, even if they're vaccinated, that they'll be respected for doing so. I wear a mask indoors. I'm vaccinated. Even if I'm only talking to one other person, I'm wearing a mask. I'm a public health professor. It's just how I roll. And so each of us, even if vaccinated, can make the decision, we're going to mask indoors while on campus. And so that actually cuts both ways in the sense that if you see someone wearing a mask, it doesn't mean they're unvaccinated.
Thanks, John. Jane, question for you. For those who are on partial disability and working from home, particularly if it's due to complications from COVID, do they need to comply with the vaccine mandate?
So they should reach out to their HR person to work through an accommodation and get the HR person to understand their specific issues and then address it through them.
Thanks, Jane. And Bob, question for you about shared office facilities and what can we tell folks that are going to be coming back to a shared office or perhaps an open workspace and what's been, what the plan is for those spaces and safety?
Sure. As we mentioned before early on that, there has been work done to understand mechanical systems and ventilation and prioritize the ability to add to air exchanges and particularly the amount of fresh air that comes in and or filtered air that comes in. So the ability to add the percentage of outdoor air or to increase the level of filtration. I understand everybody's in a different place and has different considerations. But overall, the assessment based on where we are with the pandemic, that the decision is that we are in a place as a community that we can bring people back and that we can share offices with people, and that if people are vaccinated, they can do so without masking. Again, if people have specific issues or concerns, they should be talking through OIE and considering exception. But overall, we are in a position where we believe we can come back to work and that it is safe to do so.
Thanks, Bob. Jane, in your earlier remarks, you mentioned flu shots. Will flu shots be provided for free to Hopkins affiliates this year?
We will be providing them again this year, and more information to come on that. We should be somewhere by mid-August. We should have more information. And again, We'll be uploading that information out on the website and using the Prudensity Pass as the way to monitor the flu compliance, as well as the VMS system for uploading your flu vaccination documentation.
Thanks, Jane. And John, we've spoken quite a bit about testing and those who will be required to test as part of their exception. What about individuals who aren't required to, but want to know if they'll have access to testing?
Absolutely. So the same voluntary additional testing that we've had in the spring will be available. If you aren't required to test, but you want to get a test, waltz on into one of the testing sites, spit into the tube, fill out your label, and it'll be assayed and you'll get a result.
Thanks, John. Jane, advice for international students that are having technical difficulties with the Prudensity app where they are right now before they come in. Is there an opportunity for them to get technical assistance?
Absolutely. So get them to email. We'll have you email the cao-office@jhu.edu. We're happy to help with that. We've gotten lots of questions and tried to work through the technical aspects with some of the students already. So please reach out. We're more than happy to help.
Thanks very much, Jane. And I see that we're coming up quickly on 1:30. So I will ask one final question. And Jane, that concerns the event limit of 50 and the permission. Just a clarification on that one.
Sure. Let me just make sure that I make it clear. You can have more, you can have over 50 people in an event inside. It just needs the extra permission. So we're not limiting to 50 inside. It is 50 people can attend, but if you want over 50, you need to get the special permission.
And
Thanks.
then also, just to be clear, if you're having food at an indoor event, you have to make arrangements for some distancing for those who are unvaccinated. And that is true if you have 5 people, 10 people, 50 people, 150 people.
Thanks, Jane. Thanks, John. And with that, I'm going to close us out. So I want to thank all of you for joining us this afternoon and for your continued efforts during these disrupted times. While I know that we weren't able to answer every single question, I do hope that this session has provided further clarity about our planning for return to campus. This session has been recorded and it will be available as with previous events. Thank you and stay safe.